Hello, welcome to Code Rhetoric with Tam Talk. In this lesson, we will be focusing on pulmonary hypertension. Our ICD-10 General Coding Guidelines states, for pulmonary hypertension is classified to category I-27. Other pulmonary heart diseases. For secondary pulmonary hypertension, which is category I-27.1 through I-27.2 with the fifth digit, code also any associated conditions or adverse effects of drugs or toxins. The sequencing is based on the reasoning for the encounter. In our first coding example, our patient has been diagnosed with unspecified pulmonary hypertension. So in our first book step, we're going to locate our main term, which is represented by the term hypertension. And then we're going to drill down to pulmonary, which again describes the type of hypertension. And our ICD-10-CM code should be I27.20. The rationale is because, again, our patient presented with unspecified pulmonary hypertension. The provider did not specify if the pulmonary hypertension was secondary or due to another diagnosis. Therefore, the coder should assign ICD-10 code I27.20, again, which represents unspecified pulmonary hypertension. In our next coding example, our patient was admitted for treatment of the secondary pulmonary hypertension. The patient also has a history of congenital heart disease. So in our first book step, we're going to identify our main term, which is again hypertension, and then we're going to drill down to pulmonary, and then we're going to further drill down to secondary. Our ICD-10-CM code should be I27.21. And then our second book step, our main term is disease, and then we're going to drill down to heart, and then we're going to drill down even further to congenital, because again, congenital heart describes the type of disease the patient has or is experiencing. And so the ICD-10-CM code for this particular diagnosis should be Q24.9. So our rationale, our patient presented with secondary pulmonary hypertension, and the patient also has a history of congenital heart disease. And per the ICD-10 guidelines, we are to assign an additional ICD-10 code to identify any associated underlying conditions. So based upon the patient's diagnosis, the coder should assign primary code I27.21, which represents the secondary pulmonary hypertension, and Q24.9, which represents the congenital heart disease, as our additional diagnosis. So with our coding tips for this segment, remember to assign your diagnosis based on the reason for the encounter. Ask the question, is it primary or secondary pulmonary hypertension? And then assign ICD-10 codes accordingly. Secondly, remember to assign the secondary diagnosis for any associated underlying conditions when documented. Next, pay attention to the ICD-10-CM guidelines or additional as well as inclusion notes located in the tabular list. Remember to code to the highest specificity. And as always, when in doubt, always reference your coding guidelines. This concludes our segment of Code Rhetoric with Tam Talk. To learn more, please subscribe to our YouTube channel at Abraham Medical Coding Coach Abraham, or visit our website at www.abrahammedicalcodingcoachllc.com, and be sure to follow us on Facebook, LinkedIn, and Instagram. Thank you.